So it seems to me that talking about costs and outweighing all the benefits and the risks, that the one thing left on a patient's mind is the actual procedure. Why don't you take me through the actual day of the procedure?
Okay, that's a good point. Patients are always fearful of the procedure, and I know when I sit down with them that they're scared, and you can tell. But many of them are, there's a mixture of fear and excitement because they're about to embark on a journey that they've never experienced before. The first thing that happens when they get to the center is they check in, and we go over the consent form, which is very important. Everybody needs to understand completely what they are about to do. And then after they have gone through the instructions for the procedure itself and what they're supposed to do during and after the procedure with the staff, at that point they will see the doctors. Dr. Patel and I work very closely together. Their visit prior to the surgery, they will be seeing the staff and Dr. Patel, and then on the day of surgery they'll be seeing Dr. Patel and me, remeasuring in many cases several times to make sure that we have the best data available, and then we will talk to them and they can ask questions. But the procedure itself will take about 12 to 15 minutes for both eyes. In most cases we're using 2 different lasers because we do, in most cases, all laser LASIK. During the procedure, one of us in the room is talking to them all the time. We will have people in the room to hold their hand if they need it, or they can squeeze a teddy bear. And we spend about half the time on each laser. There's virtually no discomfort. There's some pressure. There's a kind of a freaky part where their vision will go dim during the first step of the procedure. But all in all, it's not a bad experience, and they're always surprised how quickly it goes. Afterwards, when they sit up from the laser, they're going to be in focus. They will be able to see like they saw with their glasses before, except that it'll be like their glasses are a little dirty or a little wet. That gets better within minutes. By the time they're home, they're seeing quite well. And then there's a phase of about 3 months, most of it though during the first day, when the vision is gradually and steadily improving. By the end of 3 months, they are, in our estimation, over with the experience, and they are living their lives as if they had been born with the vision that we give them. During this first week after surgery, they'll be taking some drops. Those drops are basically to prevent infection, prevent inflammation, and allow the healing to go as smoothly as possible. And we're always here. If they have a problem, day or night, they can reach someone and we can help them.
So can a patient drive after the procedure?
We don't allow patients to drive home after the procedure. The vision's it's too wet. They could probably see well enough, but we wouldn't feel good about them driving. So we allow patients to drive back here the next day. And they're functioning at about 95%. The people after one day can do virtually all tasks, although visual tasks like computer work and reading, they're a little slower on those because they have to blink more in order to maintain sharp vision. But by 2 days afterwards, it's very stable and actually quite good.